Hello and welcome. Today we're delving into a fascinating, though sometimes distressing, condition: keloid formation on the ear. We'll explore what causes these raised scars, how they develop, and what can be done about them. The exact cause of keloids isn't fully understood, but several factors are believed to contribute. Trauma to the ear, such as from ear piercing, surgery, burns, or even acne, is a primary trigger. Genetic predisposition plays a significant role. Keloids are more common in individuals with a family history and in certain ethnic groups, particularly those of African, Asian, and Hispanic descent. Furthermore, factors like age, with keloids being more prevalent in younger individuals, and hormonal influences may also contribute to their development. The pathophysiology of keloids involves an abnormal wound healing process. After an injury, the body initiates collagen production to repair the damaged tissue. In normal wound healing, this process is carefully regulated. However, in keloid formation, there's an overproduction of collagen, specifically type I and type E collagen. This excessive collagen deposition leads to the characteristic raised, firm scar. The extracellular matrix, which supports the skin's structure, is also disrupted. Inflammatory mediators like cytokines play a role in stimulating fibroblasts, the cells responsible for collagen synthesis, contributing to the uncontrolled growth. Epidemiologically, keloid formation on the ear is most frequently seen following ear piercing, especially in the earlobe. While the exact prevalence is hard to determine, studies suggest a higher incidence in individuals with darker skin. Keloids are generally more common in younger adults, between the ages of 10 and 30. The familial link also impacts epidemiology, highlighting that individuals with affected relatives are more likely to develop keloids themselves. Understanding these demographic factors helps in assessing individual risk. The most prominent sign of a keloid on the ear is a raised, often shiny, and rubbery scar. It may start as a small, pink or red bump and gradually grow over time. Keloids often extend beyond the original wound boundaries, which differentiates them from hypertrophic scars. Symptoms can include itching, pain, tenderness, or a burning sensation in the affected area. The appearance and symptoms can vary depending on the keloid size, location, and stage of development. Some individuals may experience significant cosmetic concerns and psychological distress due to the keloid's appearance. Diagnosis of keloids on the ear is usually based on clinical examination. The characteristic appearance, a raised scar extending beyond the original wound, is often sufficient for diagnosis. A detailed medical history, including any prior trauma or family history of keloids, is also important. In some cases, a skin biopsy may be performed to rule out other conditions, such as hypertrophic scars or tumors. However, biopsy can sometimes stimulate further keloid growth, so it's generally avoided unless necessary for differential diagnosis. While there isn't a universally accepted classification system for keloids on the ear, they can be broadly categorized based on their size, location, and symptoms. Small keloids confined to the earlobe are often considered less severe than larger keloids that extend onto the cartilage. Active keloids, which are still growing and symptomatic, may require different treatment approaches compared to stable, quiescent keloids. Understanding these variations helps tailor treatment strategies for individual patients. Treatment and management of keloids on the ear can be challenging, as there is no single cure. Various approaches are often combined for optimal results. These include corticosteroid injections, which reduce inflammation and collagen production, surgical excision, although recurrence is common unless combined with other therapies, radiation therapy, used to prevent recurrence after surgery, cryotherapy, which freezes and destroys keloid tissue, laser therapy, to reduce redness and improve texture, pressure therapy, using clips or earrings to flatten the keloid, topical treatments, such as silicone sheets or creams, and intralesional 5-fluorouracil or bleomycin injections, which inhibit cell growth. The choice of treatment depends on the size, location, and symptoms of the keloid, as well as patient preference and potential side effects. Prevention is key in managing keloids, especially for individuals with a known predisposition. Avoidance of unnecessary ear piercing or surgery is advisable. If piercing or surgery is necessary, meticulous wound care is crucial. This includes keeping the area clean, minimizing tension on the wound, and using silicone gel sheets or pressure earrings after the procedure. Early intervention is also important. If a keloid starts to form, prompt treatment can help prevent it from growing larger. The prognosis for keloids on the ear is variable. While treatment can often improve symptoms and appearance, complete eradication is often difficult. Recurrence is common, even after aggressive treatment. Ongoing research is exploring new and more effective therapies, such as targeted drug delivery and immunomodulatory agents. These advances hold promise for improving the long-term management and prognosis of keloids. Patient education and realistic expectations are crucial for successful management of this challenging condition.